Every year on the last Saturday of April, we celebrate our new animals with a baby shower. We open our property to the public to give people a chance to explore our facility, view patients, and help us gather everything we need to take care of our babies. The donations and supplies brought in through baby shower help us meet the needs of the thousands of wild babies that will be brought to wild care during this season. This year, due to the ongoing public health concerns, we've limited the number of people who will be able to visit our facility in person, so we're also celebrating with a virtual week of videos. In this week-long series, we'll celebrate our new babies, walk you through our nurseries, and let you know how you can donate to help us take care of our babies. This is Medical Monday, and we're headed to our clinic, where we'll see Dr. Avid evaluate an adult great horned owl and learn a bit about the veterinary side of wildlife rehabilitation.
Right now we are evaluating a large wound on this great horned owl. This great horned owl came in a few days ago in pretty critical condition where it was affected by some kind of trauma, probably a hit by car type incident. But today I discovered a wound that had basically been hidden from us, and unfortunately the wound is pretty large, so we're going to use surgery to close up the wound. This is not going to be as sterile a procedure as a lot of other surgeries that we do, mainly because it is a traumatic wound, and so there's already some level of infection. We are going to start this animal on antibiotics for this wound. The other thing is with bird wounds, we can't pluck all the feathers in the area, so we clean it as best we can, but plucking the feathers actually causes a lot of trauma, so that's another major difference between mammal, including human surgeries, and bird surgeries is there's no hair to deal with, but we do have to leave a lot of the feathers intact. We do remove some of them. Now I'm placing sutures to try and close a part of this wound so we can protect those tissues. There's quite a bit of those kind of important tissues in the wing. There's not a lot of fat or extra tissue to cover them up, so if we do have exposed tendon or ligament or muscle, they do have to be closed by the skin. Bird skin is very thin, and so we try and do surgery sooner rather than later. So as soon as we found this wound, we prepared to close it up. We're putting a hydrogel on the wound now, which is going to keep the wound moist while it's healing. That's an important thing for a lot of these tissues that are in the bird wing. So we're going to apply our little bandage there. That'll help protect it. So now that the wound is covered and everything, we're going to go ahead and dry off the area. And then we're going to put another bandage on top to help keep it in place. We're going to dry off the feathers. Next we're going to apply a layer called Tegaderm. And we go through a lot of this. It's basically a very lightweight bandaging material that is pretty gentle on the feathers. It's difficult to apply bandages to the feathers without damaging them, and we do as best we can to try and keep the feathers intact. You can see what's going on underneath the bandage because it's clear, and it also is lightweight. So for a lot of these birds, to be able to allow them to continue to do their normal routine, we try and keep our bandaging as minimally intrusive as possible. This is another material that we use a lot of called vet wrap. We go through this so much that this would be another great item to have donated. We do get a lot that is donated by other veterinary clinics, but we go through it so much that eventually we do have to purchase our own. That's the goal of the wrap, is to prevent the wing from being able to extend normally. But we do want it to be lightweight, unobtrusive to this owl so that it can be standing normally, eating normally, doing a lot of that kind of stuff while it's overcoming its injury. Okay.
Thank you for joining us for this look into our clinic. If you like this video and want to help out, here are some things you can do. Number one, make an in-kind donation. You can stop by WildCare anytime with your donation items, or during the week of April 18th, you can go to any of our drop-off points in Noble, Norman, Edmond, and Shawnee. The second thing you can do is help us out by sharing and bookmarking our videos on Facebook. Or finally, you can donate directly to WildCare through our Facebook fundraiser. Tomorrow, we'll see inside our Cottontail nursery and check out how we take care of our patients there.